Welcome back to another episode of HealthCap Weekly Wrap.
Yeah, good to have you with us. We've got some really important stuff to dig into this week.
Totally. Like, did you see that even the so-called healthiest states are still struggling with high fall rates?
Right? And not just that, those same states are underusing hospice care too.
It's such a reminder that no matter where you are, there's always work to be done when it comes to elder care.
Absolutely. And speaking of care, we've got a few studies this week that take a closer look at the power of simple interventions, like hand massage and calming music, for residents with dementia.
Yeah, and then there's delirium. We're talking persistent rates over 4 decades and what interprofessional teams can do differently.
Plus, a powerful piece on why removing restraints could be one of the most important steps we take in protecting dignity in delirium care.
Let's jump into it.
All right, let's start with this report from McKnight's that kind of caught both of us off guard.
Yeah, it's from United Health, and it shows that some of the states ranked as the healthiest, like Hawaii, Connecticut, Massachusetts, are still seeing really high fall rates among older adults.
And get this, those same states are also underutilizing hospice care.
It's one of those things that makes you go, wait, how is that possible? These states have great access to care and strong prevention programs.
Right, but the data shows that even in high-performing systems, we're still missing the mark when it comes to senior outcomes.
And falls aren't just numbers, they're life-changing. One bad fall can lead to hospitalization, rehab, even long-term placement.
Exactly, and the low hospice use? That's a whole different concern. It means older adults might be going through the end of life without enough support.
Yeah, or without the comfort and dignity they deserve.
So what's the takeaway for senior living teams?
I think it's a wake-up call. Just because your state ranks high on health stats doesn't mean your community doesn't need strong fall prevention programs and honest, early conversations about hospice.
Right, and it really puts the focus back on local action. Because the broader system might look good on paper, but the outcomes that matter happen one resident at a time.
So this next one is actually 2 studies, but they really go hand in hand. No pun intended.
Yeah, both explore non-drug ways to support residents with dementia, like using music and gentle touch to ease agitation and stress.
The first one comes from a Springer-published pilot study where researchers tested hand massage on older adults with dementia in a hospital setting.
Right, and they weren't just looking at behavior, they actually measured biological stress markers like cortisol and alpha amylase.
And what they found was that repeated hand massages over time seemed to help reduce those stress levels, even if the changes in agitation weren't dramatic.
Which still matters. For residents with dementia, lowering physiological stress can prevent escalation and improve quality of life.
Then there's the second one from a 2002 study in nursing research that looked at combining calming music with hand massage in long-term care.
And that one found a clear reduction in agitation. It's one of those studies that's held up over time because it's simple, repeatable, and effective.
Totally. What I love about both of these is that they're so accessible. You don't need a big budget or a special certification. Just time, presence, and some understanding of the resident.
Yeah, it really speaks to the heart of person-centered care. Sometimes it's not about high-tech interventions, it's about knowing someone's favorite song or taking a moment to hold their hand.
Exactly. These studies remind us that small gestures can have a big clinical impact.
All right, so shifting gears a bit, this next one really surprised me.
Yeah, it's a meta-analysis published in PubMed that looked at delirium rates in medical inpatients over the last 4 decades.
And here's the kicker, delirium rates haven't changed. Like, at all.
Right? They've stayed at around 23% for hospitalized older adults since the 1980s.
Which is kind of shocking when you think about how much healthcare has evolved in that time.
Totally. We've got better diagnostics, more awareness, more staff education, but somehow delirium is still under-recognized and under-managed.
And the study even points out publication bias, like we're not even seeing the full picture because studies with higher rates might not be getting published.
That part really stuck with me. It's a silent crisis in a lot of ways.
So what does that mean for senior living teams?
Well, a lot of residents transition to and from hospitals, right? So if delirium isn't being caught or managed there, those symptoms can follow them back into the community.
Exactly. It's a call to stay vigilant. Know the signs, communicate with hospitals, and have a plan for reorienting residents post-discharge.
Because even though it's underreported, we see the effects: confusion, agitation, falls, even long-term cognitive decline.
And the consistency of this data just shows that we cannot afford to ignore it anymore.
All right, so the next one actually builds on that last conversation about delirium. This one looks at what we can do about it.
Yeah, it's a 2022 systematic review published on PubMed Central, and it dives into interprofessional, consultation-based approaches to managing delirium in hospitalized older adults.
Basically, when multiple disciplines, nurses, physicians, geriatric specialists, social workers, come together to assess and manage delirium.
Right, and what they found was kind of a mixed bag. Some models showed promise, especially those with routine screening and proactive team involvement.
But overall, the results were inconsistent. The review emphasized that we need more standardized, evidence-based models that actually get implemented across settings.
Which totally tracks. We all say interprofessional care is the gold standard, but without clear protocols, it's hard to make it stick.
And for senior living,
I think it's a reminder that our communities can be the bridge. We often are the team coordinating across hospitals, primary care, rehab.
exactly. Even if the study focused on hospitals, the lessons translate, build strong relationships across disciplines, use structured assessments, and never assume someone else is handling it.
Right, because when everyone's a little bit responsible, no one's truly accountable. This review kind of pushes us to close that loop and advocate hard for our residents when delirium is at play.
Okay, so this last one, wow. It's not a study, it's an opinion piece, but honestly, it hits harder than some of the data.
Yeah, it's from MedPage Today, written by a geriatrician reflecting on the use of restraints in delirium care and why it's time to let them go.
The title says it all. Removing restraints, reclaiming patient dignity in delirium care.
And it's powerful. She shares what it feels like to walk past an older adult who's tied to a bed rail, confused, frightened, calling out for help.
And how that moment stuck with her. Not because it was unusual, but because it was common.
Exactly. She talks about how we often use restraints in the name of safety, but end up doing more harm than good.
And for communities like ours, this piece really pushes the question, how do we define care?
Are we focused on protecting people from risk or helping them live with dignity even when things get messy?
Right. The author makes a case for training, staff support, and creative problem solving as alternatives. She's not saying it's easy, but she's saying it's necessary.
And honestly, in senior living, we're uniquely positioned to lead on this. We know our residents. We can build care plans that respect their histories, preferences, and needs.
Exactly. It's not about being perfect, it's about being intentional.
This piece is a reminder that dignity isn't a policy. It's a daily choice. One we make with every decision, every shift, every interaction.
And that's going to do it for this week's HealthCap Weekly Wrap.
Yeah, falls, music therapy, delirium, dignity. This one really covered a lot.
It did. And hopefully it gave you a few things to take back to your team, whether that's a new conversation about care planning or just taking an extra moment with a resident.
That's what it's all about. Small things. Intentional choices.
Thanks for tuning in today. And as always, if you want more details on any of the stories we talked about, you can find them in the weekly roundup on Angie's blog.
Just head over to healthcapusa.com/Angie's blog.
We'll see you next week.